Good evening. Thank you for joining us today. I'm Reverend Anna Walker, the Associate Chief Medical Officer at Good Samaritan Clinic here in Jasper, Georgia.
Hello everyone. We cover quite a bit of things that I won't talk very much about, but quite a bit don't hear much about in the news. And that is about influenza. Deaths in this country is 22,000. Now you don't hear that when you watch the news. Again, you don't hear about that because everything you see on the news, and if you realize that back in 2017-18 flu season, which is the last, and that's startling to me. I mean, I think I've run into cause the flu. It's going to prevent the flu. The reason that sometimes people get the flu, one of the good things that we are learning about coronavirus is not doing as much of that. Now let's talk a little. Virus got its name because if you look at this virus under the microscope, electron to me, but they say it's a crown, that's why they call it coronavirus, has absolutely nothing to do with virus. Got its name. 80% of the cases of coronavirus are going up, and as you know, some states are much worse, much spread, and so many people have it in New York. The coronavirus itself has been around for a while. The common cold comes from coronavirus. If you remember several years ago, SARS was a coronavirus. But all these viruses have different manifestations. Some of them affect the upper respiratory system, some the lower respiratory system. As it turns out, COVID-19, it handles it all. It affects all of it. So that's what's so bad about it. There are many bad things about it. The incubation time is 14 days. So that's why you hear people that do self-quarantine, they're in for 14 days, and then once they've gone 14 days, if they haven't had symptoms, then they're done. But then, of course, if they get exposed again, they probably need to do it all over again. The average symptoms, and this is what really makes this spread a problem, you can be exposed to it and get the virus and have no symptoms. And you can be contagious early on, and your symptoms might not start. And I remember Dr. McCurdy talking about it, and this is all I'm reading, is that the symptoms occur, I think, an average of like 5.2 or 3 days after the inoculation of the virus or before you get the virus. So you can be sitting here spreading it around and not know you have it. And there lies one of the biggest problems. What are the biggest symptoms? Well, I have a sheet that we use at Good Samaritan, and I'm going to try to get that to you. But it's a way to kind of screen some of these symptoms and figure out if you really need to seek medical attention. But the symptoms, fever. Fever over 100 we get very concerned with. But fever up to 103 we get very concerned with. But what else? Cough, shortness of breath, and increasing shortness of breath. But there are plenty of other things that cause that. I mean, you can get asthma, you can have heart failure. But who tends to get COVID-19 infection the most? People like me, people over the age of 60, are more prone to get it. Although kids have gotten it, kids have died from it, but for the most part, it's older people with comorbidities, different diseases that they have. Particularly, they say cardiovascular disease, but I think most of that has to do with people who have heart failure. Heart failure, you have fluid in your lungs, and the fluid is a medium for the virus to grow. Diabetes predisposes you to have COVID-19, really serious infection with COVID-19. COPD, asthma, those are the worst things. People, when we have somebody come in and they're having fever and we know they have lung disease or they're smokers, we get very concerned, or they're previous smokers. So that we get very concerned that they may be in that high risk category, and they are. What can you do about this to try to prevent this? Well, the country, the state, I've just learned today, the state of Florida has gone in a total lockdown. When they do a total lockdown, they mean you don't get out, period. You stay in your house. I guess you still can go to grocery stores. You can go for health care if you need it. But other than that, you stay home, period. They've done that in Colorado, where our son Jeff is located. Basically, they said they can get out and walk the dog, but they can't get out, even out to just go out for a walk or run on their own, period. They can't. So these are very extreme measures. But what else can you do? Well, you know, my hands are destroyed by hand sanitizer. I use hand sanitizer going in the room. I use hand sanitizer coming out of the room. I wear gloves. What about wearing masks? They're making a big deal about masks. Well, there's quite a shortage of masks in the country right now, but all kinds of places are making masks. They're making masks. The My Pillow guy in Minnesota is making masks. They're making ventilators with Ford Motor Company and GM. They're making ventilators because there's a shortage of ventilators, because so many sick people with pneumonia are needing respirators to help them. So there's a lot that the country's doing to pitch in. But do masks do you any good? Yes, they do. If you suspect, and what we do at the clinic, if we suspect somebody has it, we want to make sure they have a mask. But there's a certain kind of mask that we as healthcare workers use called an N95. That is they call also a respirator. It really is strong. They're very uncomfortable for us, but they're very protective of us getting the virus through droplets, and that's how it's transmitted. Through when somebody coughs or sneezes, you really should cover up, because that's where the social distancing comes from. They're saying 6 feet is what the government said, but to be honest with you, some violent sneezes or coughs, those droplets can go a lot further. And I read something recently, somebody at MIT said that it can go up to 27 feet. Now that's quite a bit of transmission, but you know, that is not practical to us to spend 27 feet apart. But that's kind of what happens. You have to cover up, you have to wash. The masks that we use, we use them at least a morning, and then in an afternoon we get another one, if we have enough. What's the best way for us as healthcare workers? Well, we probably ought to wear shoe covers, we ought to wear hats, even people like me should wear hats. We should wear masks, we should wear gloves, and wear gowns every time we see a patient. But you don't wear it out in the hallway and go to the next room, because what's that going to do? You're going to have virus on you somewhere if it's everywhere like it's beginning to be, which is scary enough. It would be ideal if we could do that and take it off, dispose of it at the door, and go on to the next patient, gown up, go in again, do that again. That would be the best way to deal with it. But we don't have the PPE or personal protective equipment to do that. What about the treatment? I mentioned before about the flu vaccine, people not wanting to have it, but it does change the flu vaccine because the virus changes. This virus doesn't change so much. When they do get a vaccine for coronavirus, for COVID-19, I would strongly suggest people get it, especially seeing how virulent this virus is and what it's really doing to people. It is kind of scary. A couple of weeks ago, I felt like the media was way overhyping this stuff, and I still think they're overhyping it, but I felt like they were really way over predicting it. But you know what? I don't feel that now. I do think that you can watch too much news and get too much in a panic. It's what I call a toilet paper effect. Why is the grocery store run out of toilet paper? What people really need, if they're going to be locked in their home for a while, is food and water, period. I mean, there are other options for toilet paper, sorry. But that's what I think the media has really hyped this way too much, my opinion. Now, what about the treatment? So there's not a vaccine yet, but there will be, and I assure you I'm going to get one. There are not any antivirals yet. They are working on 2 or 3, antivirals that can be effective against the COVID-19 virus. One of them, actually, they have found, and this was something I just read yesterday, there's an HIV drug, it's still experimental drug, that seems to be very effective to treat COVID-19. Now, what about Plaquenil or hydroxychloroquine? You hear about the malaria drug that they're doing, and we've actually used it. I haven't. I don't work in the hospital anymore, but they have used it in the hospital on some really sick people on ventilators. It shows some promise, but that was used by a physician in France, and he used it on somebody that had really sick. They were on a ventilator. He used hydroxychloroquine and azithromycin, which is a Z-Pack, which we take a Z-Pack for sometimes for sinus infections and things like that. So, but he used those drugs and found things got better. What's the problem with this? Well, the problem with anything in medicine is you really need to do controlled, double-blind studies to see if they're really effective. That's anecdotal. You give something and it helps, but how do you know it was going to help anyway? They might have been getting better anyway. So you really don't know that. But, you know, at least right now, if I can tell you at my age, if I were to get COVID-19 and start having respiratory issues, I would want them to give me that stuff, because I don't think it's going to hurt. Hydroxychloroquine's been available on the market for quite some time to treat malaria, but it's also a drug that we use to treat people with arthritis, rheumatoid arthritis, and lupus uses Plaquenil as the trade name, but hydroxychloroquine is the generic, and we use that for those people. Now, there's a lot of stuff right now going on about ibuprofen. You're hearing, don't take ibuprofen. Well, if they say don't take ibuprofen, why don't they say don't take any other anti-inflammatory drug? That's what bothers me about that. But again, I'm taking a lot of my information from the CDC, and the CDC's recommendation is do not take ibuprofen for fever. They would prefer you take acetaminophen or Tylenol for fever and for aches. Now, those of us who have the getting old arthritis kind of stuff, and those non-steroidals tend to help, I would still say, at least based on what we're hearing now, try to avoid ibuprofen, but I don't understand. If ibuprofen works, I mean, if it causes things to get worse, why wouldn't some of the other drugs in the same category not do the same thing? I don't know. But anyway, they're saying ibuprofen. I would try to avoid it, mainly because that's what they're talking about. There's also been something about the class of drugs called ACE inhibitors or angiotensin receptor blockers. We call them ARBs. They're used, I use them a lot as a cardiologist or former cardiologist for heart failure, for hypertension. Many of my patients are on those drugs for hypertension. And there's even a study, again, I read a study today out of the Lancet, which is a journal in Great Britain, about that ACE inhibitors, at least, like lisinopril, might make things worse. I can't explain why, but I can tell you the CDC, again, says until we get controlled double-blind studies, please don't quit taking those medications, because I personally don't want my patients that have hypertension to have a stroke. And if your blood pressure is not controlled, you probably would have a stroke. You're at least a higher risk to have a stroke. So that's about the medications. I just looked up this morning, and again before I came here, the numbers in Georgia, in the state of Georgia. And as of the last check with the Department of Public Health, over 4,600 confirmed cases of COVID-19 in the state, and 139 deaths. That's 3%. Nationwide, it's more like 1.2 or 1.3%. Now, why is it higher in Georgia? I don't know, but I can tell you that at one point it was higher percentage as we're doing more testing, and a number of these mild cases, and I said 80% of these cases are mild. As you test some of these people and they have mild cases, then the percentage, the denominator of this fraction is going to go up, so the percent of mortality is going to go down. So I think eventually it's probably going to be on the lines with everybody else. But right now it's about 3% in this state. Now in Italy, it's really high. It's like 6 or 7%. It's very high. And why that is, I don't know. I still don't know. In New York, it's very, very high. Again, it's because of the population density. There's a lot of people that are close. They're so close together. There's a lot of exposure. I heard recently about a young physician in New York who was 44, and he was a marathon runner, and he died from COVID-19. Now that bothers me that happens. But you know, every now and then there may be something else that we don't know about this fella. But I can tell you for the most part, people who particularly have lung disease, asthma, smokers, heart failure, diabetes, those are the people, and over age 60 are the ones that are at higher risk of having problems. I wanted to talk to you just a few minutes about what we're doing at Good Samaritan. Because, you know, one of the questions that I got here was asked, what's changed since March 18th? Well, a lot has changed, and it's changed a lot, and it's changed rapidly for us at the clinic. The first thing you'll notice if you go to Good Samaritan, besides that the double wides are finally gone, thank goodness, is that we have a big area we call a portico share right out front where people can drive through and drop off relatives or whatever. We have set up outside or just inside the building a desk where we have a nurse or another person that's a staff person at the clinic. We're checking temperatures, and we have a screening tool that we're using. And if somebody has a fever and if they are more of a risk to have COVID-19, we ask them to go back to their car. We ask the provider that's going to see them to put on their armor and go out to the car, examine them, but we first do a flu test, which a rapid flu test takes about 10 minutes. We go do the flu test. If the flu test is negative, then we'll go out and do the COVID-19. The problem about the testing, we only had about 22 kits. They're hard to come by. In fact, the Pickens County Health Department was sending patients to us to get tested, but we only had 22 kits. But yeah, it takes a while. The first one we did took 5 or 6 days to get the results back. I asked one of our nurse practitioners yesterday how long that it's taking to get, and she said she has one that's been out there 11 days. She hadn't heard anything. Now, to me, that's basically a waste to get a test on somebody for a disease that's incubation period's 14 days. I mean, you may as well just say, just quarantine yourself and wait. But 11 days, and that's at a private lab. We're now trying to figure out another place to go do that. You'll also ask about the short test, the one that they did in South Korea that the president talked about a couple of days ago. We hope that's going to be available very soon, but I think it's probably not. I think President Trump said 5 minutes. I don't think it's going to be a 5-minute test, but it might be a 45-minute test. And that way you could do something that Dr. McCurdy talked about, ubiquitous testing. And if we all had this test, then I wouldn't have to be sitting 6 feet away from Anna. If we all had this and we're negative, then we could live a fairly normal life. We could still be having church. But we don't have that available yet. So right now, social distancing, shelter in place is the best way to deal with this. What else? Oh, another thing that we're doing at the clinic besides the person being out front is that even people coming for prescriptions, they also have a walkie-talkie, and they're constantly talking with the pharmacist. This person's to pick up your prescriptions. Well, they're not quite ready yet, and they'll let them know when they're ready, and they'll only send one person in the building at a time. If somebody has an appointment for something else, we wait until the room is ready, cleaned out, and believe me, we're cleaning and cleaning and cleaning all the time. But we're doing that and letting people come back. But the thing that they're doing for me, and I almost feel like I tell people jokingly that I've been banished from the clinic because I'm 70, and the clinic personnel don't want me to come in unless I really have to be there, because I'm in a higher risk group for this COVID-19. So what we are doing is we're doing televisits. We call them televisits, telephone. We call people on the phone. Through our electronic medical record, we also have a way to do a visual, almost like FaceTime. But it's actually in the chart, and we can visualize the patient when we talk to them. But they have to be web enabled, and unfortunately a number of our patients are sort of, what shall I say, IT challenged, and they can't quite do this. But it's simple enough that if you get an email, you can hit a link and it will pop this thing up on a computer screen or a smartphone or a tablet, and you can do it that way. So we're hoping to do more of that, but those are ways that we're trying, and that's something that's drastically changed in the last 2 weeks. So that's something big changes have made. Now I wanted to show you one thing here, if I can find it. Here it is. I don't know how well you can see this, but I'm going to hold this up. He may focus in on this. This is something, and we'll give you these websites in just a minute, but one of the websites, and I wrote it up here on this, it shows this is for Georgia. And this dashed line down here is the number of hospital beds on this axis here. If nothing had been done, nothing, and we just let things go on, this thing would have well exceeded our hospital bed capacity, and there would have been over 200,000 deaths in the state. The orange line shows what happens with social distancing, and that is the 6 feet, being 6 feet away, and so it flattens this curve. That's the flattening of the curve you hear I'm talking about. But look, it lasts a little bit longer. It goes out here to June 8th. And then finally this green, and I don't know how well you can see it, this green line down here, but that's what happens when you shelter in place. And that keeps us well below the hospital bed capacity and reduces the deaths considerably. So I think what we're in for in the next, and I think they're right, that we're in for the real deal the next couple of weeks. It's going to get a lot worse before it gets better. And I think we all have to be aware of that. That's what's going to happen. We're going to have some real problems. Now, I still want to make sure people don't panic, because I think, again, if you watch all the news channels or and I see stuff on Facebook, it's just constantly stuff there about COVID-19 and what's going on. All that does is frighten everybody. Now, the websites we're going to circulate around. But I made a thing here that has all the websites. The predominant one that I've been using is the CDC. CDC.gov gives individual state information as well as the nation, but also the Department of Public Health of Georgia is also a good one. And I look at the daily status report on that. And that kind of gives you an idea of how many people have confirmed, got the virus, how many deaths there have been. It is kind of amazing to me in the state, if you look at the counties, at Pickens County, even the last I checked, 7 confirmed cases, but I know there's a couple more that aren't in this tally that are in the hospital. But there's 7 confirmed cases and 1 death so far in Pickens County related to the COVID-19 spread. But these websites, I think, can be very helpful. I would suggest doing this. I would suggest not getting too much into the toilet paper effect and getting too panicked by it. I'm going to see if, let me look at some of these questions that they gave me. I'll see if I can answer some of these. So One of these questions, have things changed? I think I've told you how things have changed since March 18th. And what does social distancing look like? Well, we're doing it right now. 6 feet. But like I said, a good sneeze or cough, they say the droplets can go 27 feet. Let's see. Safety precautions, I talked to you about that. But you know, you need to be able to go to the store. You got to go to the store. But I can tell you this, the stores in Jasper, at least, you can shop online. I suggest it. I really do. I mean, they have made it so that right after the stores, Kroger, Ingles, Walmart, they do a really good cleaning at night when they're closed. And then they open it up the first hour or so for people over 60 or over 65. And that's good for those people, but to me, if you can do it online and go by and drop by and pick it up, it might not be exactly what you want, but it'll be close. I think that's the best way to do this. Those are some things that have changed. This says, how has this changed the life of medical professionals, firemen, EMTs, nurse, healthcare workers? Well, it's obviously changed all of our lives. I mean, we are consumed with this every day, and every time we see a patient, they have many questions about what do we expect, what's going to happen to us. For us who are non-essential workers, how can we best serve those around us? Well, I can tell you at Good Samaritan, the place started off as a free clinic. We had all volunteers for the most part. We still have had a lot of volunteers, and we love and appreciate our volunteers. I was a volunteer there for a while. But we've basically told our volunteers, since most of them are retired and in a more at-risk age range, not to come to the clinic. Now that has made things difficult for us. I mean, I had some things I had to deal with. Well, we pretty much have our whole medical records department run by volunteers. And if the volunteer, fortunately one came in today, and I told her how much I appreciated that she came. But we have to send records and constantly dealing with things, but we really rely on our volunteers. So are they non-essential? Well, they're not really non-essential for us because we're finding out how much we really miss them. But we are also staggering our hours. Our patient volume is going down. I'm trying to tell people that normally would come and see me at 3 or 6 month intervals, why don't we spread it out? I'll be happy to take care of your refills so you don't come in here and get exposed to this stuff. And it doesn't expose me to this. I've had my laptop at home, and we've worked it out so that I can do televisits at home and use my cell phone and call these people. But things have drastically changed. What if you develop symptoms, and what's your timeline, and who should you tell? Well, I think if you look at that I gave a little screening tool to them. If you look at this, you wouldn't be able to see this if I show you, but it basically is what we use to screen people with, and out front. And you know, it's a point system. You can check off each one of these things: cough, shortness of breath, sore throat, age, fever. And if your score is less than 6, go home and call back if your symptoms change. If your score is 7 to 20, consult with a provider to go over the symptoms, and we'll determine if you need to get the test. And we've actually had some people early on in this process that came in the clinic, they were really offended, didn't have a fever, didn't have a cough, didn't have anything, but they wanted to get screened for COVID-19. And they were really upset with us for not doing it. So, well, at that time we only had 22 kits. We have to give this to people that we think are suspected of having this problem. And people over a score of 21, we send to the emergency department. So I'm telling you, just hang on, but I think this is going to last us for a while. Now, in closing here, I want to tell you what else can you do? Well, you better pray. I Googled scripture and COVID-19, and I found 7 or 8 really good scriptures that I think are really good. I want to read them to you. Psalm 34:4. I sought the Lord, and He answered me and delivered me from all my fears. Because I think this is scary for all of us. It's scary for healthcare workers, I can assure you it's scary. There's another one, Philippians 4, verses 6 and 7. Do not be anxious about anything, but in everything by prayer and supplication with thanksgiving, let your requests be made known to God, and the peace of God, which surpasses all understanding, will guard your hearts and your minds in Christ Jesus. So, strong prayer for everybody, particularly for the healthcare team, because we're on the front lines. So that's really about all I have to tell you about COVID-19.
Well, Dr. Austin, we have had some questions come in. One of them is there is a man, he is over 70, and he is participating in the senior hour at the grocery store. But if he has other options of a younger person going to get groceries for him or even online pickup, what would you recommend as the best option for those seniors who do have options for grocery shopping?
Well, I feel pretty strongly that the online version of shopping is probably the best way to do it. You get closer to what you want rather than send somebody in with a list. But I think both those options are fine. I really do. I think that, what we're starting to do, and I can tell you that my wife likes to go to the grocery store, but I've convinced her that maybe this is the best way she needs to do her shopping, because I don't want to have her in there on the other end of the house quarantined from COVID-19, quarantined from me. But that's, I think, the best way. Any other questions?
One more. If you have someone in your home that does develop symptoms and has a diagnosis, what is the best way for people in that household to stay safe?
You basically, once one person in the house is confirmed to have COVID-19, you pretty much ought to quarantine the whole house, because more than likely they all will. More than likely, this is very contagious. More than likely, they'll all get it. Now, you can try to be distancing as much as possible, but these things, there's all kinds of reports about it lasts longer on plastic than wood or metal. Well, the virus is pretty, it hangs in there for quite a while, and it's very difficult. I can tell you, for me, one of the difficult things, where they say, cover up when you cough or you sneeze. Don't put your hands on your face. Well, I put my hands on my face. I can't help it. I do it a lot. We all do. But you have to try to do that and do a lot of hand sanitizers. And, if your home, your dwelling is large enough, put the person that has it, isolate them as much as possible. But more than likely, somebody else is going to get this, and it would probably be better to quarantine most everyone in the household, I think.
Well, thank you, Dr. Austin. Thank you for your information and answering our questions. The links that Dr. Austin gave are in the description of this video, and we will be posting the point system that he mentioned from Good Samaritan Clinic on our Facebook page, as well as emailing it out to our congregation. Please stay updated with those links as best you can, and let us know if we can serve you in any way. And again, thank you, Dr. Austin, for all the information that you have given us.
Thank you, and everybody.